men don't bleed out of their penis every month. So we need, well, if they did, we'd have a different conversation.
But free. Period products would probably be
thank
free.
you.
Yeah.
I recently highlighted the burden of heavy menstrual period on the NHS at the Parliamentary Select Committee hearing. This paper out today shows that the NHS faces an estimated 13 million burden for heavy menstrual period, and it's completely preventable. This landmark study calls for an early care and also to reduce hospital admissions and blood transfusions. This first UK-based multi-centred observational study has been done, and when the researchers looked at the UK-wide evaluation of acute heavy menstrual bleeding that required red blood cell transfusion, the study also analysed that from 98 NHS gynaecology units between January and June 2024, they found that 1,332 women were admitted for acute heavy menstrual bleeding. They received a transfusion, and the average hospital stay was between 2 days. And with most patients, they received an additional treatment such as tranexamic acid. Also, they might have needed mefenamic acid as well. They needed iron supplements or hormonal management as well in order to help with the lining of the womb to make sure that was suppressed and so that their bleeding was also reduced as well. Now, nearly half of the women had uterine fibroids. So that is one of the reasons why women were getting such heavy bleeding. We also know adenomyosis, endometriosis, PCOS can also cause heavy bleeding as well. And 20% of women were discharged while still anemic and left to navigate the long waiting list for definitive care for the heavy menstrual period. So this study highlights we need a shift from being reactive to proactive care, because at the moment we're not managing heavy menstrual period and it's causing a lot of money. But there has been an update, and you might have missed it, which says that even if you have a normal hemoglobin but a low ferritin level in menstruating women, so those that aren't in menopause yet, then they may benefit from a referral for IV iron therapy. So yes, especially if you're symptomatic, to get an iron transfusion. The guidelines now say you cannot ignore heavy periods as being just a period. We have to carefully monitor women's ferritin levels, ensure that it's about 70, especially if they're having heavy menstrual period because of uterine fibroids. Check their transferrin, their B12 levels, their iron levels as well in menstruating women, because also the thing is that we need to put an iron supplementation, and that's recommended for 6 months or more, making sure other things are ruled out. Oral iron supplementation is recommended, particularly if you are menstruating as women and girls and you've got a background history of endometriosis, adenomyosis, PCOS, fibroids, uterine fibroids, and that's causing you heavy bleeding. Then it's recommended to go on iron supplementation such as oral ferrous sulfate, ferrous fumarate, and ferrous gluconate. Now, I know the biggest issue is compliance, because actually they are horrible medications. I've had to take them myself, and it causes constipation, bloating. It can also cause like a horrible gastroenteritis or gastroenteral symptoms as well, and that might not be tolerated well. So it does account for that in the guidelines to consider oral replacement, including alternative days, so having oral medication which is having it every other day, or ferric maltol. And even look, parental iron preparations, that means probably thinking of taking about iron transfusions in symptomatic patients. So please do not put up with your heavy menstrual bleeds. I know it's really frustrating, but blood tests, getting an ultrasound scan to find out the root cause, thinking of medication, that could be tranexamic acid to make sure we reduce the flow, making sure that we're thinking about hormonal treatments if that's appropriate, or even having interventional things like having a hormonal coil put in, like a Mirena coil, that will reduce the flow depending on where you are on your fertility journey. But there are lots of different things that we can do, and I hope the NICE guidelines helps you navigate that journey with you and your NHS GP. As always, happy to take any questions.